What if I told you a depot injection designed to last 1 month releases 40% of its drug in the first few hours? That's not sustained release, that's a formulation failure. And this exactly problem nearly derailed one of the most important peptide depot formulation, and that's Leuprolide. Hi, I'm Raghuveer Singh Parmar, Director Scientific Affairs at Resolve Mass Laboratories Canada. Resolve Mass Laboratories stands at the intersection of analytical excellence and complex drug development, helping pharmaceutical teams overcome critical challenges in peptides, impurities, and regulatory pathways. So let's understand the real problem in Leuprolide. So Leuprolide is a GnRH agonist used for prostate cancer and endometriosis. The therapy only works when hormone suppression is continuous, not intermittent. So clinicians needed something very simple in concept. One injection that lasts for weeks, but technically this is incredibly difficult because peptides like Leuprolide are highly water soluble and depot system rely on hydrophobic biodegradable polymers like PLGA. That mismatch creates a perfect storm. Instead of releasing slowly, the drug burst out immediately, and in early prototypes, this wasn't a small issue. It was a 30 to 40% of burst release right after injection. That creates plasma spikes, hormonal flare, loss of sustained exposure, regulatory red flags. At that point, the depot concept almost fails. Let's understand the root cause. So, what was actually happening? What was the root cause? When scientists looked closely at the microspheres, they noticed something important. The peptide was hydrophilic, the polymer matrix was hydrophobic. This created microchannels inside the particles. Once injected, water enters, peptide dissolves, and drug escapes. And another insight: higher drug loading made things worse. More drug near surface, more porosity, more burst release. This meant the issue wasn't just polymer selection, it was particle architecture. That's a key lesson most formulations overlook. Now, let's talk about strategy 1, and that is polymer optimization. So the first attempt to solve this was polymer tuning. Scientists increased PLGA molecular weight. Why? Because higher molecular weight slows degradation. They also adjusted lactide-glycolide ratio. More lactide makes the matrix more hydrophobic, reducing water entry, and this worked. This worked partially actually. Burst dropped from 40% to about 25%. Better, but still unacceptable. So the problem clearly wasn't just polymer chemistry. It was something else as well. Better, but still unacceptable. So the problem clearly wasn't just polymer chemistry. It was something else as well. So let's talk about strategy 2, and that is particle engineering. So the next the focus shifted to process design. This is where things became more interesting. They optimize water oil water double emulsion, internal aqueous phase volume, solvent evaporation rate, stirring speed, and many other parameters. But the goal was simple here, to reduce porosity, create dense microspheres. And when they analyzed the particles, they saw smoother surfaces, less internal channels, and more compact structures. Now burst stopped further around 15%, but still not ideal, but getting closer. Let's talk about strategy 3, that is drug polymer interaction control. This is where the real breakthrough happened. Instead of only controlling polymer, scientists controlled drug behavior. They modified the salt form of Leuprolide. Why does this matter? Salt form affects solubility, diffusion rate, mobility inside matrix. By reducing solubility, the drug stayed trapped longer. They also enhance drug polymer interactions, reducing mobility inside the matrix. Now burst dropped below 10%. Final formulation achieved about 8% burst release, and suddenly the release curve looked like a true depot. The final formulation delivered a minimal initial burst, smooth sustained release, 1-month pharmacokinetics, predictable plasma profile. These transformed Leuprolide into a once monthly depot injection. And from a formulation standpoint, this becomes a classic case study in sustained release design. Now here is something important. In real world development, burst release is rarely solved by just changing polymer. Most failures happen because teams ignore particle porosity, overlook drug solubility, skip salt screening, focus only on degradation kinetics, but sustained release is actually a 3-variable problem: polymer, process, and drug properties. All 3 parameters must be optimized together. Like polymer, process, and drug properties, all 3 should be optimized all at once at the same time. This is something where we often see with complex peptides and long-acting GLP-1 analogs, where a minor oxidation products or truncations also influence release behavior. Sometimes the burst isn't even visible until you combine release testing with LCMS impurity mapping, and then you realize degradation products are diffusing faster than the parent molecule. We have also seen depot programs where simply switching peptide salt from changed release kinetics more than altering polymer composition. These are subtle formulation levers, but they can completely reshape performance. So what should you remember from this case study? First, burst release is a structural problem, not just a polymer problem. Second, porosity controls diffusion and diffusion controls burst. And third, salt form and drug mobility are also powerful but underused tools. And finally, the successful sustained release requires balanced diffusion and degradation, not just slowing everything down. Leuprolide depot wasn't solved by one tweak. It required integrated formulation design, polymer chemistry, particle re-engineering, drug interaction control, all working together, and that's the real lesson. Sustained release isn't discovered, it's engineered. Thank you once again, and see you in the next one. Goodbye for now.